So just imagine the person is immediately collapsed in some public place. What will you do? So just look at the scene safety. If he is on the main road or just in the main center of the road, so move him to the side. If he is sitting on a chair, make him lie down on a flat surface and look at the situation. Now the next step is to check for responsiveness. Is the patient responding to any command? So in India, you can call the nearest hospital or the nearest ambulance if you have got the number. Otherwise, you can call many people for help. And I'm sure few of the bystanders will come for you help. So certainly, then just explore the center part of the chest of the patient and then remove his clothes. And second step is to assess for the pulse. So to assess for the pulse is you have to check if the patient is breathing or not. Or if he is also, for looking at the pulse, you have to go to the center of the his neck and check for the trachea, the elevation of the trachea, and the center of the neck. You move your fingers towards the left or right in the groove of your neck. From the center of the neck, you have to move your hands towards the right or towards the left to assess for the pulse. So check for the pulse. Like in this patient, he is neither breathing nor he has pulse. So immediately we have next step. We have to go to the next place to step to start chest compression. So first, with see which hand is your dominant. Like in my case, I have my right hand as my dominant hand. So with the dominant hand, you place the heel of your dominant hand towards the center of the chest between the two nipples, and the other hand you have to clamp over the other hand. Okay, and you have to just elevate, means do not flex your elbow. You have to keep your elbow straight and just clamp your hand, and the whole pressure you have to kneel on the patient. And I will straighten my elbow and kneel on the patient and start with the compression of 100 to 120 degrees. This way it will go. And the compression should be about 100 to 120 per minute, and it should compress 2 to 2.5 inch after each compression. And relaxation is done, so the chest is required. When the compression, when we compress the heart is acting like a pump which was stopped. What happens when we compress the chest and the heart is getting compressed, so that the heart is acting like a pump which will now give artificial compression, and by this blood is pumped into the brain and the heart vessels, so that they are getting oxygenated blood. While we relax the hand, the recoil is happening, the blood returns back to the heart. So when the heart compresses again and again, this way the compression should go. So we should loudly do the compression, because we know that after 30 compression, if there is any airway device, we can give breathing to the patient. If we don't have any airway device, we should continue giving the compression till the help is arrived. So people will find it difficult to continue it for a long time. So help is needed. So it is very helpful if someone stands by you or some bystanders help you in giving the compression. So after 30 compression, one person will take over the other and do the next set of compression. Thank you.